Hi, welcome back to Corrective Movement Therapy with Mark Duffy. Today we're going to be talking about headaches and migraines. So headaches and migraines are different, clinically speaking, but they can compound each other. And treatments are fairly similar. So the first thing when you're going to be talking about headache is you're going to be talking about brain-derived neurotrophic growth factor. This is similar to nerve growth factor, which we talked about in a previous video that relates to the sensitivity of the nerve endings to pain. So when this is elevated, you get increased sensitivity and you get increased pain. Now, one of the best ways to discuss headaches is maybe something like lack of sleep. So when we don't have enough sleep, one of the things that becomes elevated is brain-derived nerve growth factor, or neurotrophic factor. Now, because of this, light becomes hypersensitive to our eyes, and screens start to have eye strain more likely, and then other issues with that. So the other thing is that there's other fundamental components like for affecting migraines, particularly in women. Now this is estrogen driven primarily, so it could be that individuals that are very underweight aren't getting enough caloric nutrients to keep their fat tissue up, and then they have a lack of estrogen as a result. In the same instance, you could have too much fat, and then you get an issue of basically women producing too much testosterone, and that hormone fluctuates is an issue. Now, the best ways is to try and get it to healthy weight, but there's also other pharmacological methods that we can use. One of the best ones I would look towards is Excedrin. So Excedrin is a combination of a couple different drugs. One is caffeine. So caffeine is a great way to reduce headaches. In individuals who are coming out of anesthesia, they actually ended up having headaches, and that's a result of caffeine deprivation. So if you have too much caffeine too regularly, your body basically becomes dependent upon that. You get headaches from that. The other issue is that you can use it actually though as a benefit. So if you don't have headaches often and don't consume caffeine, using caffeine a little bit will help your headache. The other one is acetaminophen that helps your brain as well. It's basically just it's like a Tylenol except for it works centrally. Now the last one I'm going to recommend is something that isn't in Excedrin, but it's a magnesium supplement. So one of the most common issues with people who are suffering from migraines is a magnesium deficiency. So get your magnesium. There's plenty of brands out there. I wouldn't recommend getting one that's 100 or 2,000% of your daily value intake. Like 67 or so percent is fine, like 250 milligrams. So basically, yeah, Excedrin, Tylenol, Excedrin, magnesium, get your sleep, and get at a healthy weight. This has been Corrective Movement Therapy with Mark Duffy. Thank you very much.